Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living, Abilities in Motion.
Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living.
Hello and welcome to Disabilities Issues and Updates. I am your host, Teresa Faulkner, Community Outreach Coordinator at Abilities in Motion. We are located at 210 North 5th Street, Reading, Pennsylvania. Our zip code is 19601. You can reach us at 610-376-0010, and if you'd like to speak directly to me, my direct extension is 108. You can also check us out on Facebook, Twitter, and other social media sites. Please feel free to contact me with suggestions for future topics. Today's topic is MCOs, which is Managed Care Organization, and CHCs, which is Community Health Choices. We have a guest panel today of Jennifer Strausser, got that right, Jennifer, Director of Quality Assurance and Compliance, Nicole Painter, who is Nursing Home Transition Manager, and Erin Johnston, who is Quality Assurance Office Support. Welcome, ladies.
Thank
good
you.
to have you on the show.
Thank you.
Wonderful, wonderful. So glad to see you. You ready for a great show?
Absolutely.
Before we get started, we're going to have a little short video, and then we're going to start our discussion.
Healthcare can be complicated. Maybe you have more than one provider. You might even be covered by more than one insurance. Wouldn't it be nice if there was someone to help coordinate it all? That's why Pennsylvania is starting Community Health Choices.
If you're 21 or older and have both Medicare and Medicaid, or receive long-term supports through Medicaid because you need help with everyday personal tasks, you'll be covered by Community Health Choices. Community Health Choices will coordinate your services to improve the quality of your healthcare experience. We'll serve more people in communities rather than in facilities, giving them the opportunity to work, spend more time with their families, and experience an overall better quality of life. This will affect more than 420,000 Pennsylvanians. Are you one of them? Here are 4 things you need to know. Number 1, there is nothing you need to do until DHS contacts you. We'll reach out and help you make informed choices about the future of your care. 2, you will be able to choose a managed care organization in your area that will help improve the coordination and quality of services and take the confusion out of healthcare. 3, all participants will be clearly informed about their participation in Community Health Choices. And 4, your coverage will continue uninterrupted and you will have no gaps in coverage. Community Health Choices, providing choice, promoting independence, and making it easier for Pennsylvanians to live in their communities. Brought to you by Governor Tom Wolf, the Pennsylvania Department of Human Services, and the Pennsylvania Department of Aging. For more about Community Health Choices, go to www.dhs.pa.gov.
Panel, let's get started with the discussion. And Jen, we're going to start with you today. Let's talk about Community Health Choices.
All right, Community Health Choices is an exciting movement that is going on in the state of Pennsylvania right now. Several years ago, the Office of Long-Term Living with the Department of Human Services in Pennsylvania decided to kind of change the way that they oversee and manage long-term services and supports. And it was decided to go with Community Health Choices, which utilizes managed care organizations to ensure not only physical health care for individuals with disabilities and aging adults, but also the long-term services and supports. So through a process of about 3 years, the state of Pennsylvania has been transitioning into Community Health Choices. In January of 2018, the state started with the rollout of CHC, or Community Health Choices, in the western region of the state. And then last January in 2019, the Philadelphia zone, which also included Bucks County, Delaware, Montgomery, decided to go over into community health choices as well. And just in little over a week and a half, the third and final rollout will occur on January 1st of 2020. So basically what's happening is individuals who have been served through the Office of Long-Term Living on certain waivers, including the aging waiver, the independence living waiver, the attendant care waiver, the ComCare waiver, are all moving into community health choices waiver. So there will be a period of time where each individual will be assigned, actually everybody should be assigned by now to a managed care organization.
So when did that actually start, that the cutoff for that?
The cutoff is actually today.
Oh, okay.
Today,
great.
December 20th, all individuals who are eligible and are already receiving services through one of the waivers I had mentioned will be assigned to a managed care organization, or hopefully, if they had the opportunity, they should have received paperwork in the mail with information of how to choose who they wanted for their
Okay.
managed care.
Okay.
Now, there are 3 providers. One of them is UPMC Community Health Choices.
Okay.
Another one is Amera Health Caritas, and the third one is PA Health and Wellness. So these are the 3 organizations that the state of Pennsylvania has contracted with to provide the managed care services.
Okay.
So today, if there's participants watching and you are not sure who your managed care organization is, we're going to share a number a little bit later that you can call for clarification. And if you decide today that you don't like that organization, you could always change as well. Today is the cutoff day.
Okay.
And we'll talk more about that as we move further along.
Okay, great. Now I wanted to ask Erin, we know with rollouts there are many different challenges that come across.
Absolutely.
So let's talk about some of those things, Erin. Challenges.
Well, I think primarily one of the challenges was the process of information. It came out as sort of a mass mailer, and I think, unfortunately, sometimes people, in the rush of doing their day-to-day activities, they might not have realized how important some of those documents were, and they might have either put them to the side, or they might have just tossed them away, thinking it was just, something, just another piece of junk mail.
Right.
So what has started to happen is then there were more informational rollouts. There were community meetings. There were moments like this where we had the opportunity to chat with people on the phone or in person so that they could find out specifically what their choices were. One of the other problems really turned out to be that people just were overly concerned, understandably, with, well, I don't know what this means, so what do I do, and how will it change the benefits that I already have? And the good news is it won't change your benefits at all.
Wonderful.
The piece of this is really just adding, hopefully, a streamlined way of ensuring that you get what you need faster and more efficiently. So the problem really was mostly just calming everybody's nerves, helping them understand that this was a good choice and that it really wasn't going to change their services at all.
Okay, great. Now, Nicole, you're on the end of nursing home transition. Let's talk a little bit about that. What is that, nursing home transition? Can you give me a short summary?
Sure.
Great.
So we work with an individual that's in a nursing home and wishes to transition.
Okay.
So we can use a various method of ways to work with that individual to get them on these waivers through community health choices, as well as identifying housing or setting up that household with furnishing, whatever it is that consumer needs or individual needs to get out of a nursing home.
Okay.
So
to be able to live in the community and so forth.
Yes, as independently as possible.
Wonderful. And how will these changes affect persons that are dealing with that? Is it a lot, or is it a little bit, or?
Sure. So they will continue to get all of the same services they currently get in their nursing home. So they will still get all of the daily meals, the nursing attendance, etc. It's just it'll just change how agencies like ours work with someone to get them out of the nursing home.
Okay.
So nothing will really change. They'll get all the services they get now. It's just who we work with as well. It's another benefit that we
Okay.
can work with
Okay.
to help get them out.
Okay. And even though I think you were going to use the word barriers, that's fine. There are issues. There are things that come up, and so definitely we want to help our viewers to know what to do when they come across these problems. We do want to let you know that if our viewers are watching today and would like to call in and ask us some questions, we are available. The number you can call is 610-378-0426. Again, if you're watching today, the show is live. You can call in and ask our wonderful panel questions that you might have. Again, that number is 610-378-0426. Ladies, what other things do we need to talk about as far as this managed care, community health choices? Are there other issues or concerns, or just information we need to tell persons?
I think one of the biggest topics or areas to remind people of is for the first 180 days, nothing is going to change at all.
Okay.
Their point of contact will remain the same. Whoever their supports coordinator is right now will stay the same.
Okay.
And there's a period of transition where people can sort of get their feet wet and really experience what the CHC is going to offer, and then the transition will really kick into effect.
Okay.
So again, we just want to reemphasize that their standards will not change and the services that they're getting will not change. The most important piece that we can stress is that no service will change in those 180 days. People will come out, you'll start to meet some new people, there'll be new contacts made, and your system might be reassessed, but nothing is going to change.
Okay.
And then as the service really rolls out, they really shouldn't see a difference in the services they're receiving. The only difference is potentially a point of contact. They're going to meet some new people.
Erin, I like you said services. Can you give us for instance, some example of services? Can you do that
Sure.
for us? Will you do that?
Sure, services can include anything from in-home meals for people who are eligible to in-home services, attendants who could come in and help with light housework or running errands or just helping someone get out of bed in the morning. We have, it goes all the way through to making modifications to the home to make it safer and more accessible. There are modifications that can be made to vehicles and really anything in between. It's the objective of this has always been to help people live as independently in the community as possible. So any service that would help do that is potentially offered.
Wonderful. Well, it lets me know that we had the right show today. We have a home viewer who has a question. Are you there? Go ahead, please.
Hello.
Hello. Hi. How are you?
I'm fine. I have three questions for you guys.
Sure, sure.
How will this affect the services I receive? That's the first one.
Okay,
Could
let's
you
start.
answer that?
Okay, sure. Go ahead, please.
All right, well, Erin actually kind of just addressed most of that. Current services that participants have and are receiving will not be affected during the first 180 days. It's called the continuity of care period. So any services that are in effect starting January 1st will remain in effect for the 180 days. After that, it's up to each managed care company as far as they're going to be doing assessments with individuals, assessing needs to make sure all individuals...
When will I hear from my new service coordinator?
When will you hear from it? Well, your service coordinator will remain the same during the continuity of care period. So whoever your service coordinator is now is the one that you'll want to contact with any questions that you might have.
Did you get that, sir? And did you have another question?
How do I make changes to my service plan?
Actually, it's quite simple. You simply want to notify your coordinator that you've had a change in status or that you have an additional need. And by reaching out to your coordinator and expressing what your need is, the coordinator will start the process to develop that aspect of your plan. So really, again, it's just about communication and reaching out to your coordinator.
So you have to actually talk to your service coordinator concerning that. Did you have another question? Well, I think he's gone. Ladies, let's kind of deal with some more questions. I don't know if he's still there, but he's gone. But let's kind of talk a little bit from the nursing home transition. If somebody is looking to transition, they would have a service coordinator, or how would that work?
Yes. Every participant or individual living in the nursing home who is through a managed care company paying for their stay at the nursing home will receive their own service coordinator through that insurance company, so through that managed care organization. And that individual would be able to refer any participants to a nursing home transition agency specifically. Or if you're currently working with nursing home transition, then you'll still stay with your same agency through that continuity of care period. And the nursing home transition agency would be able to help them, as we said before, identify the barrier, what it is that's keeping them in that nursing home, and work on overcoming that barrier. So finding housing, and et cetera.
Okay. Is there any other thing that maybe we didn't really touch on that we might need to talk a little bit about? Let's talk about contact information. If persons are watching and they have more questions or concerns, who can they contact? So the first contact could be their current service coordinator or nursing home transition coordinator with whichever company that they're working with. But they can also contact the Community Health Choices participant line at 833-735-4416. So that would be if they have any questions, concerns, things they'd like to address with the participant line. And we also stated earlier about if they wanted to make a change to which agency, which insurance company that they're working with, they would contact the independent enrollment broker, which is a phone number of 844-824-3655. Thank you so much. I believe we have another home viewer. Go ahead, please.
My question is, with all these insurance agencies, what is the difference between them?
So to be fair, the best way to determine what the differences are, as well as which one would be the best fit for you, is to review each of them online. And you still have up until today to make those choices. There are, I apologize, I have to refer to my notes. You can also reach out to the IEB. That number is the number that Michelle just gave, or I apologize, Nicole just gave. Goodness, I should have more coffee, I guess. 844-824-3655. Or you can go to enrollchc.com. And there's actually a really nice comparison that you can do. You can sort of plug in what you need or what you feel are your most important things that you're looking for within the system, and then you can compare and contrast them. It's actually a really nice website. It's very well done.
Very good.
Okay, thank you.
Great. Jen, I wanted to ask you, are there other things that consumers, I know the consumers called in and asked questions, but can you think of anything from a consumer's perspective that they might ask the question about?
Okay. Yeah, most of the questions that we're receiving from consumers now are coming, I think, from an anxiety of not knowing what's going to happen with their services. And again, it's going back to remind consumers of the 180 days where services are not going to change, things are going to stay in place, and that they still will have a service coordinator who is making sure that their needs are being met in their home. So it's a lot of reassurance phone calls and questions that we're receiving.
Great. And it must have stimulated our callers. We have another home viewer. Go ahead, please.
Hi, this is Evelyn, and my question for you today is, what is the way that a person transitions from nursing home transition into the community, and what are the requirements? Like, how long does it take, and what's the process?
Nicole, I think that's
Okay. So the first question was how somebody transitions. So as I stated earlier, there would be a service coordinator through that managed care organization that is assigned to the individual or participant, as well as a nursing home transition agency. So we work together. We have multiple interactions with each other as a large team, as a person-centered team, to identify the exact barriers And once we've overcome the barriers and we have a proposed plan in sight, we all work together to come up with an exact date for a transition, and we come up with what someone will need in the community, such as waiver services. So caregivers in the community, meals being delivered, exactly what it is. And we work with that service coordinator through the managed care organization to set that plan in motion. And I know I can only speak for our nursing home transition program, but most of them, we actually support the individual through the entire process, meaning the day of discharge. We are there to make sure everything goes smoothly. We make sure that everyone has their medications, any medical equipment. We go to the participant's house and make sure that they arrived safely, that they have everything they need in that house. And we continue to follow up. We do a phone call the next day or an in-person visit at various stages to make sure that everybody is still on the same page, that all the services are being delivered, and that the safety of the individual is our main focus.
I think communication is really a big part, as Erin had said. Viewer, did she answer your question?
Yes, she did. Thank you very much.
You're
Ladies,
so very
have a
welcome,
wonderful
and
day.
thank you for calling. Thank
You're
you for
welcome.
calling.
Bye-bye.
It seems like a lot. It seems like, I know with the little short clip that we had and then the panel, it seems like there's a lot of information out there. So again, panel, if persons are concerned about transitioning from the nursing home, if they're concerned about community health choices, let's reiterate who they need to contact.
All right, well, very first, if somebody has concerns, call your current service coordinator or the service coordinator agency that you're currently working with. From there, they will help you navigate the system, the process. Again, there's also Community Health Choices participant hotline that you can call, and that number, again, we'll reiterate that, is 844, excuse me, I was given 833-735-4416. Again, this is the Community Health Choices participant line, 833-735-4416.
Thank you so much for doing that. I know that there are a lot of questions. If you have questions, you can contact us at AIM and we can give you that information. We can actually give you that information. The number again, if you call us at the 610-376-0010, they'll be able to give you the same number, the same information that we gave you this morning. But we want to, our show is almost over and we are actually coming to a close. So we want to say to all of us on the panel, to all of you, we want to wish you a Merry Christmas, Happy Holidays, and a wonderful New Year in 2020. Merry Christmas to all.
Disabilities, Issues, and Updates on BCTV is supported by the Berks County Center for Independent Living.